Hi everyone, Nicole Moore, Low Carb Keto Health Dietitian here. Today I'm going to talk a little bit about potassium. I get a lot of clients coming in that are on certain medications that actually can cause their potassium levels to drop. So for example, if they're on diuretics and so they've been told by their health professionals or their doctor, you need to keep your potassium up, and often the go-to is you need to eat bananas. So when we come in and start talking about sort of a low carb program, bananas don't really work well because a banana on average contains 20 to 30 grams of carbohydrate, which is up to 5, 6, 7 teaspoons of sugar, depending on the size of the banana, which will impact your glucose, your insulin, your inflammation and chronic disease. Whilst we're trying to improve that, we usually recommend mainly to try and have some berries like raspberries, strawberries and blackberries, because they sit at a half a punnet at only 4 grams of carbohydrate versus that banana that can go up as high as 30. So how else can we get our potassium in our diet if we're not going to eat bananas? So one of the things you can use is the diet or the light salt products that you can buy in your supermarket. And trust me, they've actually been around for years and you would have seen them sort of sitting on the supermarket shelf. So Google diet or light salt and those products will show up, and you'll see those in your regular supermarkets. And generally they are a combination of potassium chloride as well as sodium chloride. So in the old days, as I call it, when we used to put people on a low salt diet to try and get their blood pressure down, which we now know can be definitely linked to insulin resistance, and so a low carbohydrate approach works really nicely, is that people were often put on a diet salt product because that actually helped to reduce the amount of sodium in their diet. So I guess the upside is if you are someone that needs to be mindful of potassium, particularly if you're on a diuretic, even on a low carb ketogenic journey, we recommend doing some electrolyte drinks where you put a little bit of diet salt in with your water and some magnesium to sort of give you a good electrolyte balance, because these things can be a little bit mismatched when you're on a ketogenic diet. Your kidneys excrete a lot of water and that impacts sodium and magnesium, potassium. So ideally, even if you're you're doing a low carb approach, we would often recommend increasing your potassium. And if you're particularly on medication that puts you at risk of lower potassium anyway, like a diuretic, then yeah, it's really important. But no, we don't need the banana. So some things you can use: the diet salt or the light salt. And depending on the brand, they can be quite high in potassium. So we usually just recommend adding a 1/4 teaspoon a day, and that will just help bump your load up. You need about 4,700 milligrams of potassium a day. So a 1/4 teaspoon may give you, depending on the product, may give you 400 or 500 milligrams. So it's not, it depends on which one you're purchasing, but usually start with about a 1/4 of a teaspoon, and our doctor here, Dr. Lauren Lawler-Smith, can keep an eye on potassium levels. Avocados will give you some good potassium. Tomatoes and tomato paste will also give you potassium. Even a good salmon steak or good tuna steak actually has good sources of potassium in them as well. So, consuming these foods, green leafy vegetables, chard and spinach, are also good sources of potassium as well. So if you are concerned about your potassium, particularly if you're on medications that can induce a low potassium level, then you do not have to eat your banana. You can replace that with plenty of green leafies with your lunch and your dinner. Throw some tomatoes in the mix, add some diet or light salt, maybe some water or to your food. Throw in some avocados for good mix as well. Where you can, you might be using some tomato paste in a low carb zoodle bolognese. You'll be able to boost your potassium. Eat smoked salmon, eat fresh salmon, eat tuna steaks. And if you continue those great quality superfoods, you will still consume your potassium intake without having to load yourself with carbohydrates. All of those foods I've mentioned are generally lower in carbohydrate and will fit nicely on your low carb journey and will help you boost your potassium. If you want, knowing that your recommended sort of dosage is about 4,700 milligrams, maybe you do a little bit of a potassium count and use an app like Easy Diet Diary, and you can pop all your food in and how much you eat, and it will actually add up how much potassium you've had for the day. Otherwise, if you don't want to be, a super sleuth like that, it really is about using and consuming regularly those foods I've discussed, and you will be able to get your potassium up very nicely. So hope that gives you a little bit more insight about how to boost your potassium on a low carb diet. If you want to get more information, please visit us at lowcarbketohealth.com.au. We've got information on there about our amazing 12-week low carb life program, and also always information about our up and coming amazing low carb retreats. So check out our website, share us with your friends who are maybe starting their journey, and I look forward to chatting to you again soon. Bye for now.